Jamaica, along with two other Caribbean nations, has achieved zero transmission of HIV and syphilis from mother to child. Joining us now to talk about the significance is Deputy Bureau Chief of Latin America and the Caribbean AIDS Healthcare Foundation. That's a mouthful.
Missy.
Dr. Kevin Harvey. Morning, Dr. Harvey. How are you?
Good morning. Thanks for having me.
Great. A massive achievement.
It is. It's a long outstanding achievement. We have been working on this for over 20 years. The program started in Jamaica back in 2002 when we got a small grant from the Elizabeth Glazier Pediatric Foundation through the University of the West Indies with Professor Celia Christie. And back then, HIV was seen as a threat to the Jamaica's economy. And the government actually took a loan from the World Bank to fight HIV. And that's when the mother-to-child transmission prevention program started in 2002. So it's about 22 years.
We're the third in the region to achieve this?
We're not the third, but we're the largest country in the region to have achieved it. Most of the other countries like Anguilla, St. Kitts, Cayman Islands, they're very small, with very small populations. So they never had a lot of HIV transmission to children in the first place. But Jamaica is the largest country. Largest English-speaking country, because Cuba was actually the first
no surprise
to achieve
there.
it in 2015.
So when we have regional counterparts who are achieving it sooner than we are, why would it take us so much longer? Because if we're benchmarking and we can learn best practices, why would it take us longer?
Well, Jamaica, the population was so diverse and huge, and we were starting the program a little bit late compared to some of the others. But as I said, the program was twinned with syphilis elimination as well. So we're doing well with HIV, and then they twinned it with syphilis. So we have to eliminate, well, the goal is to really get to less than 2% transmission of HIV from mother to child. And that's what we have gotten to now. But it took us some time. The program was a struggle, the whole HIV program, because as you can imagine, it's about reducing HIV among men as well, because they're passing it on to the infants. The medication initially was a struggle because you had to take several pills. Now it's one pill a day, so that made it easier as well.
We've really come a long way.
Yeah, it's tremendous.
Describe the program for us, though. You know, you speak about, for example, like the medication, etc., and changing the mindset, you know, for people to be more responsible. But what are some of the other elements?
Well, the program is a comprehensive one, and it starts from you getting pregnant. So if you're HIV positive and you get pregnant, the most important thing is going to your antenatal clinics, getting the necessary prenatal care, antenatal care, and make sure that you're healthy at the time of delivery. But in addition to that, we treat the HIV to make sure that your viral load, the number of viral particles in your body, is extremely low, what we call undetectable. And once you become undetectable, you're not able to transmit HIV, not even from a man to a woman.
Really?
Yeah, so undetectable means that you're unable to transmit HIV. And so this is why we want to get the whole set of persons with HIV on their medication and becoming undetectable, because that will then plummet the transmission rate among the whole general population and not just mother to child. Now, if you come into the hospital and we test you and you're HIV positive and you missed all of that intervention, we can still give you medication around the time of delivery, or we can do a cesarean section to make sure that the baby is not exposed to the mother's blood during delivery, and that also reduces the risk. We also go on to give medication to the baby for a couple months after delivery to ensure that while the mother is breastfeeding, she doesn't transmit to the baby as well. So there's a whole program in place. And because the antenatal system is fairly okay, despite the fact that we're seeing a slight increase in maternal deaths recently, we are able to eliminate mother-to-child transmission because we have a robust antenatal care system.
Why are we seeing an increase in maternal deaths? Shouldn't we be moving in the opposite direction?
It should be, but I think COVID has distorted a lot of things.
I see.
You know, so we need to. Our maternal mortality rates now is somewhere up to 200, and we're trying to get to 73. So,
so tell us a little. Let's look at baseline. Where did we start in 2002? What did the numbers look like? What are the numbers looking like now?
Well, on average, 1 in 3 babies can be born with HIV once the mother is HIV positive. So we're moving from around 30% transmission rate to less than 2% transmission rate. So you're talking about having, 20, 30 babies born per year to maybe 1 or 2 nowadays.
Wow.
So yeah, we're practically at zero.
Yeah,
I mean,
exactly.
still 1 or 2, but
exactly.
Yeah, that's
and
amazing.
some years they may be 0, but we've really made a dent in all of this.
Yeah. I mean, I'm not going to ask you to do a shout out, but when you think of the success of the program, the results speak for themselves. Who are some of the key partners and people in the healthcare sector that would have made this work or a result possible?
Well, the program was actually started by myself and Professor Celia Christie. That was my first job in the Ministry of Health at age 30 to do the mother-to-child transplant.
Yes, Doc, tell us how old you are.
And it was very, very, very challenging, because at that time, the nurses were not told about a person's HIV positive results. So they were delivering babies and not knowing the HIV status of those babies. So that was one. And the second thing was that during those days, it took 6 months to get back your HIV results.
Jesus.
So we introduced what we call the rapid test, where you could get back your... And we started to train the nurses in prevention of mother-to-child transmission and got the nurses involved. So if I had to give a shout-out, I would want to give a big shout-out to the midwives and the nurses who worked on the antenatal wards. We had a group of nurses that we call PMTCT nurses. They are specialist nurses working at the Victoria Jubilee, the University of the West Indies, and in all the region, Cornwall Regional, who focused on this program. So the PMTCT nurses over the years, I would like to really shout them out and give them the big up.
That's the prevention of mother-to-child transmission, PMCT.
Yes, prevention of mother-to-child transmission. They're the ones who made sure that the program worked.
I wonder how, what their mindset would have been at the start. So we measure all sorts of other things, but let's look at just how we used to view HIV and AIDS back in even 2002.
Yes.
And how we're doing now. You must have even had health professionals who were scared.
Everyone was scared. No one wanted to touch the program. And so one of the first things we actually had to do was to introduce what's called PEP, that is post-exposure prophylaxis. So we actually brought in a program that would protect the healthcare workers. So if you got accidentally exposed, we could treat you immediately within 24 hours to prevent you becoming HIV infected.
Really?
Yeah, and that actually gave the healthcare workers a little bit of comfort and got the buy-in for them to start intervening in the...
I didn't even know that was possible.
Yeah, so if you get exposed, even again during sexual contact, if you're raped, etc., by somebody who's HIV positive and you're able to visit your health facility within 48 hours, we can do an intervention to prevent the transmission.
Did you know
of
that?
HIV.
I was 2 years old.
Oh my gosh.
Yeah. So there are lots of things that can be done. We have all the tools necessary right now to prevent and control HIV. As I was telling someone outside, that if you are HIV positive and you're on your medication consistently, your viral load is suppressed, you can't pass it on to your partner who is HIV negative.
And you can live
a happy, healthy, normal life.
Healthy, normal
life. Your life expectancy is the same as someone who is HIV negative.
Well, we really have come along.
Yeah, and it's 1 pill a day. It's much better than some people.
And you can get it through health fund. One time it was prohibitive, no?
It is absolutely free throughout the country.
So we've spoken about this as a milestone for Jamaica, looking at us comparatively with the other folks across the region who've done this and across the world. No, we can add our names. For you though, Doc, this is a personal victory. How does it feel to be in this role at this time, in this historical moment?
For me, yeah.
When you were 30, you started.
I did a lot of work on this, and I suppose it is. I think it was my destiny to have gotten into HIV, and I'm still doing HIV work now across the region. But there's so much more that is to be done, because we're still seeing a lot of young persons becoming HIV infected, and we know we have the tools to prevent all of this. But we need to be doing more education in schools. We need to still be talking about condom use. we still need to get persons who are HIV infected to take their medication consistently, and providing some of the social support to ensure that this continues. Because the elimination is not just now. We have to now sustain it across the years.
Correct. Yeah. Good job.
Thank you.
Good work. You ought to be very proud.
Yeah, so that was your first job in the ministry. What's your next job going to be? No.
Well, I spent like close to 18 years in the ministry, and I transitioned from there to becoming the chief medical officer and then the permanent secretary. I was one of the youngest permanent secretaries.
Next stop, taking over the world. Doc, thank you so much
for
the work that you've done. This is fantastic news for all of us.
Indeed.
Yes.
Indeed. Deputy Bureau Chief, Latin America and the Caribbean, AIDS Healthcare Foundation, Dr. Kevin Harvey.
All right, folks, after the break, the new rule for U.S. asylum seekers. We'll talk about that after this.